Good afternoon, everybody. Today I get to sit with Michelle Young, who is the Nurse Residency Program Director at Hendricks Regional Health. And she is going to talk to us today about her residency program and answer a couple of questions for us. Thank you, Michelle, for joining us today.
You're welcome. I'm happy to be here.
So let's start out by saying and talking about what is your residency program?
So our residency program is pretty special. We're actually the first one in the state of Indiana that's with Vizient ANCC Nurse Residency Program that's been accredited with distinction. We just found out last week that we got accredited with distinction, so that's exciting. And the reason that ours is special is because we have a different format than most other nurse residency programs. So our nurse residency program, when you get hired and accept a position here at Hendricks Regional Health, you're automatically placed into our nurse residency program. And when you're placed into our program, you actually spend the first 10 weeks with me, and I have you rotate through 38 of our interprofessional departments. And what you'll do during those 10 weeks of rotation is you'll learn the basis of skills so that you can be prepared to take care of patients and start your orientation on the unit. So you won't even go to your home unit until 10 weeks after you've been hired, and we focus on a collaborative learning and skills acquisition time during those 10 weeks. And then after the 10 weeks, you'll start unit orientation, and then you'll start our professional development sessions, which are monthly professional development sessions that we meet monthly with your cohort, and we go over different things, and that happens for about 10 months, where we go over professionalism and communication, delegation, things like that. And we purposely make it not lecture-based. It's all like making sure that you're applying the knowledge that you've already learned in school. So we're excited about that, especially our accreditation with the distinction. So it's fun.
Congratulations on that.
Thank you.
That's awesome.
It is awesome.
I'm sure it took a lot of hard work.
It did. There were a lot of people involved. We had a big group of help, but yes, it's definitely exciting.
So tell me or us more about the cohort size and the timing of the cohorts.
Sure. So we do 3 cohorts a year, and the start dates vary based on when most people are graduating and passing their boards. So we do 3 cohorts a year. Our residency program started a year and a half ago, and we've had 32 nurse residents. So our cohorts average usually about 6 to 8 people, so it's pretty small. Which is nice because we can have a nice close relationship. And again, the residency program, the first 10 weeks, it's just you and I. You're not actually with anybody else. You're just rotating to the different areas with the skills facilitators or collaborators in those units. So that's exciting.
You mentioned boards and passing boards. If a student is on their way to graduate, but they haven't taken their boards yet and they're scheduled to, could they still apply and still apply for a position with Hendricks?
They could. They can absolutely apply for positions. They won't be able to start the nurse residency program until they have their RN license, and that's on purpose. We did that because of the skills that you're acquiring. You have to be a nurse to do those skills. And so it's not like a clinical where you're, with somebody. You're with somebody, but you're actually doing the skill. That's the point. And so we have to have you licensed to do that. But we do have a position called a patient care intern, a PCI, position that you could move into prior to passing boards. You could just discuss that in your interview and ask them if it'd be okay if you started before you passed boards.
Okay. And what about for students who might be in their beginning stages of the nursing program, in like maybe freshmen, sophomores, juniors?
I would definitely recommend that, if they want to get into Hendricks, which I highly recommend they do, they should. You'll want to get in on any of our kind of entry-level positions. So we have UCA positions, which are just a unit clinical assistant, so it's a tech position. We also have what's called a clinical attendant, which is just a transporter where they kind of transport everybody around or transport equipment around. It's just really good to get your foot in the door at Hendricks. We're a small community, and if you work here, it's a high probability we'll find you a position if you're working here. You'll certainly be the first pick over somebody who's coming from the outside for an RN position.
Perfect. And then my last question to you is, why do you like working at Hendricks?
I love working at Hendricks because of the people. I know people always talk about their culture, but ours is just really unique. It's a small community hospital. We're not owned by a large system, so we really are able to make change at the bedside. The nurses are. We have a lot of unit practice councils because we're a magnet. And I've been at other hospitals where you have unit practice councils and you're supposed to be able to make decisions with your professional governance, and then it goes to the bedside. But it doesn't actually happen at those places. Like, it still has to be vetted by other people. And at Hendricks, it's really cool. Like, if you see something that just needs to be changed or it's not best practice, you bring it up in your UPC, conversation happens, we look at the evidence, and change happens. It's so cool to be able to, you have a change in nursing. You can change what happens at the bedside and the care of our patients. And everybody's just so wonderful. Every time, I help to teach orientation here, and everybody's always like, you guys are so nice. You're so nice. Like, you walk down the hall and people say hi. Like, it's weird. So we're just very friendly. Because, again, we know that we're caring for each other's families and friends. I mean, almost somebody's related to somebody. I can promise you that at Hendricks. So I just love it.
And if a student is interested, what should their next steps be?
Yeah, they can just go to www.hendricks.org and then /apply or careers, and you can look for positions there. And again, I would look for, if you haven't graduated yet, look for some UCA or PCI. They're just going to be posted as a UCA. You automatically become a PCI if you're a nursing student based on where you are in your schooling. Or again, there's other positions like a teletech position, which would be great if you were looking to get into like an ICU or an ED. It would be really great for you to get into one of our telemetry tech positions. Kind of get your foot in the door. Plus, you learn how to do some rhythms, which is cool. Or again, our clinical attendant position. So, kind of look outside the box to get a position to get into the Hendricks system, and then go from there.
Perfect. Well, we thank you for your time on behalf of our staff at the Exchange and our students, and we look forward to getting this information out to our students.
Wonderful. I'm looking forward to meeting everybody.
Thank you.
You're welcome. Bye-bye.